As a result of being placed in dangerous situations, troops are subjected to life-threatening scenarios, acts of violence, the loss of loved ones, and tremendous levels of both physical and emotional stress. These experiences have the potential to have a significant impact on their mental health, which can result in difficulties such as post-traumatic stress disorder, PTSD, anxiety, depression, and survivor's guilt, respectively. In spite of these problems, a significant number of troops are able to triumph over these mental obstacles by utilizing a combination of personal resilience, support structures, and therapeutic interventions. The psychological effects of battle, as well as the manner in which troops cope with it and recover from it, are investigated in this video. The psychological effects of the conflict. Disorder of post-traumatic stress, often known as PTSD. Veterans who have served in the military are frequently confronted with post-traumatic stress disorder, PTSD. It is a condition that manifests itself after being exposed to or witnessing traumatic events, such as intensive warfare, explosions, or the passing of fellow soldiers. PTSD is characterized by the following symptoms. Flashbacks, nightmares, or intrusive thoughts are all examples of reliving the traumatic experience. The act of avoiding situations or persons that bring up recollections of the traumatic event is known as avoidance. Being easily startled, angry, or having trouble sleeping are all symptoms of hyperarousal. Persistent emotions of guilt, despair, or alienation from loved ones are examples of negative alterations in mood and cognition. Both anxiety and depression are present. A person may experience feelings of anxiety and despair as a result of the hardships of battle and the adjustment back to civilian life. Individuals who have been in the military may have emotions of loneliness, a sense of purposelessness, and an inability to connect with individuals who have not had experiences that are comparable to their own. Those who suffer from anxiety associated to combat may exhibit symptoms such as hypervigilance or a persistent sense of being on edge. The guilt of surviving. Soldiers who struggle with the emotional load of surviving an event in which others did not are said to be suffering from the condition known as survivor's guilt. There is a possibility that this guilt will result in emotions of worthlessness or unworthiness, which will make it challenging to move forward with life after returning home. It is a moral injury. In the context of psychology, the term moral injury refers to the psychological suffering that takes place as a consequence of actions or the absence of actions that violate a person's moral or ethical code. During warfare, troops may be confronted with situations that are morally dubious, such as taking lives, seeing atrocities, or being unable to save others, which can result in feelings of intense remorse and humiliation upon the soldiers. Mechanisms of coping and mental toughness are discussed. A significant number of troops exhibit amazing resilience, learning to cope with or recover from the hardships they face in the course of war, despite the enormous psychological impact that combat has. Among the most important strategies are training and mental toughness are essential. In the course of their training, members of the military place a substantial focus on developing mental toughness. Soldiers receive training that teaches them how to concentrate under pressure, how to combat fear, and how to persevere through intense physical and mental trials. Many soldiers are better able to deal with the mental challenges of war thanks to the mindset that they establish during training. Unit support and camaraderie are included. When it comes to providing soldiers with emotional support, the camaraderie that exists within their units is among the most potent sources. Many times, the ties that are established as a result of shared experiences of peril, adversity, and dependence on one another for survival are profound and long-lasting. When soldiers need to process their feelings and share the burden of their experiences, they frequently turn to their fellow soldiers for support. There are Stoic principles. A Stoic mindset is adopted by some troops, which enables them to psychologically detach themselves from situations that are beyond their control and concentrate on how they will respond to adversity. Soldiers are encouraged to accept adversity as an unavoidable component of life through the practice of stoicism, which helps them develop emotional resilience by assisting them in processing challenging feelings such as fear, wrath, or guilt. CBT also stands for Cognitive Behavioral Therapy. Cognitive behavioral therapy is a popular treatment for post-traumatic stress disorder, PTSD, and other mental health concerns associated to combat. The force of intrusive memories is diminished, and soldiers are able to build healthier coping skills as a result of cognitive behavioral therapy, CBT, which assists them in recognizing and challenging detrimental thought patterns. The therapy of exposure. Exposure therapy can be helpful in desensitizing soldiers who suffer from post-traumatic stress disorder, PTSD, to the horrific experiences that cause them to experience flashbacks or anxiety. Through the process of confronting and processing these memories in a secure and regulated setting, soldiers can learn to lessen the emotional impact that these memories have on them over time, as well as meditation and mindfulness. Soldiers can better manage their stress and anxiety by grounding themselves in the present moment through the practice of mindfulness, which includes activities like as meditation, deep breathing exercises, and progressive muscle relaxation activities. Through the use of these activities, troops are taught to concentrate on their own thoughts and feelings without passing judgment on them. This helps them to better regulate their emotions and lessen the impact of hypervigilance or worry. Counseling and support groups are examples. Peer counseling and support groups can give veterans with a forum in which they can discuss their experiences with other individuals who are familiar with the specific difficulties that come with being in battle. The communal approach helps to alleviate feelings of loneliness and facilitates the healing process via the sharing of experiences. The medication. Medication may be recommended in certain instances to assist in the management of symptoms associated with post-traumatic stress disorder, PTSD, depression, or anxiety. When used in conjunction with therapy and other coping methods, antidepressants, anxiety medicines, and mood stabilizers can be useful. This is especially true when the pharmaceuticals are used to treat depression. Support from family and community members plays an important role. Getting involved with the family. Soldiers who have returned from combat are extremely fortunate to have the support of their family members. The provision of emotional support, the identification of the indicators of mental health difficulties, and the encouragement of veterans to seek professional assistance when it is required are all ways in which families provide assistance. And further benefit of re-establishing familial connections is that it gives one a feeling of stability and normalcy. Community and veteran services are available. Veterans who have access to community services that provide counseling for mental health, assistance with employment, and social reintegration programs are more likely to experience significant benefits. Veterans are provided with essential resources by organizations such as the Veterans Affairs, VA, in the United States and other similar organizations throughout the world, as they manage the transition from military service to civilian life. Reintegration into civilian life after exile. Getting back into civilian life after serving in the military can be one of the most difficult obstacles that veterans face. It is possible for veterans to discover new purpose and meaning in civilian life through the assistance of programs that provide employment training, career counseling, and peer support. These programs also help reduce the risk of long-term psychological anguish. In order to overcome stigma, seeking assistance is necessary. In the military, there is a stigma surrounding mental health. The act of seeking assistance for issues related to mental health has traditionally been regarded as a socially unacceptable behavior within the military. If soldiers reveal that they are having difficulty, they can worry that they would be viewed as feeble or unfit for duty. Getting rid of this stigma is extremely important since, if left untreated, mental health problems can get more severe over time and lead to more dangerous results. By promoting open dialogue and discussion within communities of veterans and members of the armed forces, it is crucial to have open conversations regarding mental health. It is possible for the military to cultivate a culture in which mental well-being is prioritized as an integral component of overall mission readiness, if they make the issue of mental health more commonplace and encourage soldiers to seek assistance when they feel they require it. Despite the fact that combat takes a significant psychological toll on soldiers, many of them are able to triumph over mental problems by cultivating resilience, engaging in treatment, utilizing support systems, and developing coping techniques. Soldiers can benefit from mental training, companionship, and access to mental health treatments, despite the fact that post-traumatic stress disorder, PTSD, anxiety, and moral harm are widespread. It is possible for many people to recover, regain control of their life, and continue to serve as examples of resilience and strength if they are provided with the appropriate resources and assistance. If you enjoyed this video, give it a thumbs up. Got any questions or feedback? Drop a comment. Don't miss out on our latest content. Hit that subscribe button now.